Now, some people will have areas in their back teeth where food gets stuck. And this may be just because of the anatomy of their teeth, or it could be that they have a little bit of gum disease and they've lost some tissue where that usually blocks that food between the two teeth. And so what I have here is a Proxy brush. It looks like a little Christmas tree. It's on the end of a brush. And what you do here is you push that little Christmas tree in between the teeth. And typically there is some bleeding. What do? You wipe that under the sink, the water. You go back, and you can put some toothpaste on the Proxy brush, or baking soda to get a little traction to get that the plaque out better. And what's important is to remember that you're coming from the front side, the cheek side, as well as from the tongue side. So you're pushing that through, straight through, and where some people get into a problem with the technique is they'll push the end of this, they'll kind of rotate the end in. And you really want to almost hold that Proxy brush so you're moving the whole thing back and forth. See how this is different than this? As long as you get that motion, the Proxy brush won't bend. And sometimes what happens is if you do the other way, it'll come out like this and you have to straighten it. So as long as you get that straight in motion from the front and from the back, straight in motion, the Proxy brush won't bend and will be cleaning more effectively. So there are some people who will come in and they'll have some calculus. What's calculus again? It's plaque that's hardened, like little kind of little barnacles on the back of the teeth, or even in some cases on the front of the teeth near a gland where saliva comes out, the parotid gland. On these upper teeth here, the first or second molar, the steak-eating teeth, upstairs or downstairs. And so one good way to reinforce the 45-degree angle is to use what I call a tuft brush. I don't know the name of it, but anyhow, I assume they have it at the drugstore. And what we're trying to do there is you're getting the back side of the tooth, the middle side of the tooth, and especially in between the teeth with this toothbrush. And people who have that loss of gum tissue particularly like this kind of toothbrush to get in between those teeth. It's easy. It's kind of almost like using a toothpick in combination with a toothbrush. And what's important is you get that, of course, from the front, and you're getting that 45-degree angle. It's almost like you're just walking along where the tooth meets the gum from the front, from the back to the front of each tooth and in between each teeth. And you're also doing that from the tongue side. You're getting in there. You may have to change the angle somewhat. You may have to hold the brush differently. But you're getting that angle where the toothbrush is coming in more or less at a 45-degree angle. So you're really cleaning where the tooth meets the gum, which is the location where plaque can build up. Okay, and of course from the front side and from the back side on the top and bottom teeth.